Are you working with school-aged children who stutter? And are you looking for ways to be more effective in your work? In this video, you'll be meeting some elementary school-aged children who stutter and the professionals who work with them. You'll see some examples of stuttering as it actually looks and sounds in this age group. Next, you'll hear these children talk about some of their feelings. And finally, you'll see some experienced speech-language pathologists show you how to help school-aged children who stutter. To begin, let's look at some speech disfluencies which help us determine if stuttering is a problem for these children.
Kids with ADHD or autism want to be independent. Try Goalie, the visual scheduler that guides them through routines so you don't have to. Goalie, reinventing routines.
The following are examples of 4 of the more common types of stuttering. First, we'll see some examples of monosyllabic whole word repetitions. To begin, let's watch Christy repeat the word cuz.
Let's talk a little bit about talking. Is talking hard for you, or is it easy? Is it hard sometimes and easy?
Well, sometimes I talk too fast because I'm excited.
Next, let's watch Quentin repeat the words I and den.
What did you do to remember?
I think of something like it goes on paper.
Okay.
And then I just came up with a paper clip.
Let's watch that again.
I think of something like it goes on paper.
Okay.
And then I just came up with a paper clip.
Here we see some examples of repetitions of sounds or syllables. Let's watch Chris repeat the M sound in the word my.
My first name's Chris. I'm 12 years old and I'm in 6th grade.
Let's watch Chris repeat N in the word not.
For families living with ADHD or autism, preventing meltdowns is everything. Goalie reduces stress by enabling kids to complete routines independently. Goalie, reinventing routines.
Once in a while, but not all the time.
Let's watch that again.
Once in a while, but not all the time.
Finally, we see Jamshade repeat S in the word see.
You can see what their problem is, and you can see what their problem is, and
here are some examples of sound prolongations, a third type of stuttering. First, Christy will prolong the first vowel sound in the word sometimes.
And then sometimes I stumble over words.
Stumble over words.
And then sometimes I stumble over words.
Finally, let's see Justin prolong the E in the word we.
It was like we were driving through farm fields.
Blocks or stoppages of speech are sometimes the easiest to recognize. First, let's watch Drew block on the initial K sound in the word classes.
Well, what my classes are.
Now watch as Erica blocks on the B sound in the beginning of the words bumpy and block.
So tell me what bumpy speech is.
Bumpy speech is when I have a hard block.
Here we see Justin block on the P sound in the word pushing.
What were your speech helpers doing there?
They were pushing too hard.
They were pushing too hard, right.
They were pushing too hard.
When we observe blocking, such as you have just seen, it is less likely that the child will improve without therapy. There are no fixed rules about how often a child has to stutter before we recommend treatment. However, if the child is concerned or frequently produces the types of speech disfluencies we just saw across different situations for several weeks or months, we will want to enroll him in therapy.